So give us an update on Care Closer to Home.
So in terms of Care Closer to Home, there's kind of two that go into one here, and what I mean by that is that we have an approach on what we would call the Calderdale side of our geographical area, and then we've got an approach in the Greater Huddersfield side, which is a part of our area and also what you would call half of the local authority footprint of Kirklees. If I deal with the Calderdale part first, some of you may or may not know that we've become a vanguard site together with general practice, together with people like Swift Law Carla, together with our commissioners. And what I mean by a vanguard site, that's an opportunity for us to see particularly what we can do to improve care closer to home, reduce hospital admissions, and or where people need to be transferred from hospital care back into the community or back into their home. How can we look to improve that? And we're working very closely with commissioners because, as some colleagues will know, we provide community services on the Calderdale side, and we're working very, very closely to meet what our commissioners expect, and that seems to be going okay at this moment in time. I'll have some more updates because there's some quite important decisions as to the future, probably around September time, but I'm quite hopeful that we are going in the right direction. It would be fair to say, and you've probably picked up for those of us particularly on the Greater Huddersfield side, that things are less clear on that. We've been in a situation where, together with 3 GP federations across Greater Huddersfield but also North Kirklees, we bid for the Kirklees Care Closer to Home contract. Unfortunately, we were notified that we weren't the preferred bidder, but we have to be honest and say that together with our partners, we have some reservations about how that process has been undertaken, and our reservations are really deeply rooted in concerns for the quality of patient care into the future and the sustainability of that quality of care into the future. And together with, we've got 175 CHFT Trust colleagues who will be directly affected as a part of these proposed changes, and we want to make sure that we do right by them. So what we are doing, driven by patients and also driven by the need to make sure that our staff get the best for them, is we are referring the decision that's been taken by the Kirklees commissioners. We're referring that to Monitor, just to ask them to have a look at the process, have a look at our concerns. They may say, actually, we've got a great deal of sympathy with your concerns and therefore we want you to review this. They may say that to the commissioners. Equally, they may say, actually, we've looked at the concerns and we think that the commissioners have gone through a reasonable process. We just want to make sure, as I say, particularly with our patients in mind, thinking about what everybody knows is going to be a real challenge in the likes of winter. We want to make sure that we are doing the best for our local people, and therefore I think it's been right, or will be right, for us to have raised that with Monitor and to get an independent view about the process. And again, I'm hopeful that probably around September time, maybe early October, we can give an update as to where we're at.